It's also the baby boomer generation that's becoming age 65 and older.
Yeah.
So.
And I think that's another part of the argument being the long-term check. Once the baby boomers get through the system, those coming behind, there won't be as many of them, okay? And they'll be healthier. Again, I mean, you're projecting, these are long-term projections.
What about the healthcare system itself? The facility or capability of the healthcare infrastructure cannot actually absorb what we have for those patients right now. We can't heal them, we can't cure them in most of spending in the hospital. Then the patient prolong their disease, time, and then just they go home and they go back to the community, and it costs more money.
All right, well, there's an element of that. There's also an element that some of our public policies are costing us. Okay, seatbelt legislation is costing us because before seatbelts, a lot of people died in car accidents. They're not dying anymore. They might be injured, but they're not dying, and that's costing the system.
I was talking to one of our neurosurgeons who now has something to do with the BC government. He's sitting on some, I can't remember what he does exactly for them, but he says that they have to sit around and have discussions about how healthcare is costing us twice now because we're doing all this preventative health, but still people are still getting sick later. So in fact, we're paying for it twice.
It's complex. It's complex. Okay, we've got to move on. There's a lot more to cover here. Most of our healthcare system is publicly funded, most being 70%. It's 100% covered. The rest is covered by individuals. Okay? Some of that is privately delivered. We can get into private healthcare, but let's pass that for now. We have 13 interlocking health insurance plans. We have about 100 health regions across the country that coordinate care, and we have about $60,000. 1,000 nurses and 26 other health professionals. This gives us an idea, a very effective little diagram as to where healthcare is happening. Okay, so each day in Ontario, and I don't expect that although the data is 2002, 2003, I don't expect it to change very much, if at all. There were 50 hip replacements in knees, 2,000 scans, 3,000 people admitted to hospital, 12,000 ER visits, 41,000 x-rays, 54,000 lab or specialist visit, and 137,000 people seen by a primary care physician. And I don't imagine that has changed a whole lot. Another little picture which is interesting about citizens of Manitoba, and again I would think that's fairly typical of the country. Again, I wouldn't be surprised there would be much difference. 80% of the population visited a doctor, 68% got a prescription, 12% of 75 years and older in primary care, 7% were hospitalized, and 3% were in home care. Okay, this just came out a couple of days ago, the most recent study of Canadians about how they feel about their healthcare system. And this particular study was more about how Canadians feel about Canada and the issues. And healthcare came back to the top of the list of concerns. It surpassed the economy and jobs and things like that, which was the case the year before, 2 years before. So it was steep because it was also possibly a delayed effect. One of the things that's fairly consistent in the studies is that the Canadians as a population are concerned about healthcare. But Canadians who are in the healthcare system rate it very high. There's a very high satisfaction of Canadians, and there's a lot of studies that show that Canadians are happy with the healthcare system once they're in it.
In it, like working
being treated, in it? No, being treated. Being treated. They're happy with guys like you, Glenn. They're happy with the care they're receiving generally. I mean, not 100%, but it's generally positive. Where the concern is getting into the system. The long wait times in emergency, the long wait times to see specialists like Glenn, the long wait times for MRI scans and CAT scans, that's the concern. But once people are in the system, they're generally happy. Put up their hand, someone with their hand up. See your hand? No. Someone wanted to make a comment? Okay. Anyways, this is the latest survey that just came out. This is something to sort of appreciate more from a business point of view, but healthcare is a big business, $183 billion business. And one of its unique characteristics is that its leaders change frequently. The CEOs change all the time. This is data that was done by one of our graduates, actually, from our undergraduate program. She did this when she was working at KC.icicles, showing the change from 1992 to 2005. Okay, so a period of what, 13 years. Look at how many health ministers we had, how many deputy ministers we had, how many federal ministers we had. Which means every time we change a health minister and a deputy minister, as was just done in Alberta, again, after that health minister was in post, I think, for less than 2 years, all of a sudden, he's gone, someone else is in there. The staff working around that individual all have to start all over again and re-educate, reorient the senior executive. Okay. And the new health minister in Alberta, I have no idea who he is. I'm sure he's a fine man, but he comes with no healthcare background whatsoever. And the new deputy has no background in healthcare. So all of a sudden they have to become familiar with healthcare. And they have to run their multi-million-dollar business. In Alberta, it's $4 billion or something for healthcare in Alberta. So that's one of our issues in Canada.
I'm just wondering, because since Canada has like 13 different territories and provinces running
Correct.
different
Yeah.
healthcare systems, just in relation to the population base, we only have 37 million people here in Canada. And there are so many countries or just regions in the world that they have a greater population than Canada. They still have national base, just like national-wide.
There's not too many national systems.
Yeah. Is there any kind of a trend in Canada or kind of debate in the legislation level just to try to bring different provinces together?
Not to my knowledge.
No?
I mean, we have, well, wait till you see what regionalization looks like. This is from Saskatchewan. Someone's from Saskatchewan Valley. Let's see how many health regions we have in Saskatchewan. You're raising it. Saskatchewan can't come together as a province in terms of regionalizing healthcare for less than 1 million people. Saskatchewan about 1 million people, right?
Sorry?
Saskatchewan's about 1 million people. Yeah.
I'm not sure. I
Yeah.
only recently moved there,
Okay.
so.
And so no. I mean, it's I can't conceive the provinces giving up healthcare. Sorry, that's just. Okay, financing. Just quickly. Money basically comes from individuals primarily through taxes into the federal provincial coffers, and from there they go to the providers. Now, the federal government, this is a little misleading, the federal government doesn't really get involved, very, very little get involved in direct paying of providers. The federal government really puts their money, this is where most of it comes. They put their money in the provinces, and the bulk of it then goes from the provinces to the providers. The two major providers being the hospitals and the physicians. Okay. 6 of the 10 provinces spend more than half of their revenues on healthcare. Well, this is a projection. Probably will occur before 2035, because already a number of them are pushing the 50%, which means half of what a province spends is on healthcare. And probably, I don't know what the number is for education, but it's the next big chunk is education, which means everything is left over for roads, and maintenance, and parks, and all the other public services that go with it. So healthcare is the big ticket. The national picture as of 2009, the 2010 data hasn't come in yet, so here's where we see that we've been gradually increasing our percentage of GDP. There's the 90s, sort of early 90s thing that you're talking about, Robin, where the federal government started to try to decrease the national debt, brought it down, but they also brought down their contribution to well, Canada started spending less in healthcare in terms of percentage of GDP, but we also had a strong economy in those days too. And it's slowly been rising and continuing to rise. It's been basically 70% public and 30% private for forever. Here's where the money goes generally. Most of it goes to hospitals, okay? The next biggest chunk is on drugs, physicians, other professionals, and so on, okay?
Dr. Protti, when you say drugs, what's in drugs?
Drugs are all the medications that are purchased in pharmacies.
Excursion or for what, but
Okay.
preventing side effects or making systems natural?
No.
It's all-
Okay, drugs are physicians prescribed drugs. Okay? Canadian hospitals, unlike other hospitals around the world, there are drugs within that hospital. Okay, those drugs, for while the patient's staying in the hospital, show up in the hospital costs. They don't show up in the drugs. Okay? Patients do not generally leave. Correct me if I'm wrong, doctors. Patients do not generally leave a hospital with drugs. They leave with a prescription. It has to be filled. Correct?
Certain types of drugs.
Yeah.
You can charge for.
Generally. Yeah.
Sometimes you give them, you might give them like from emergency, they might give them a pack of.
Yeah, for a day or
4
so.
C3s or something.
Yeah, for a day or so. Right.
But oncology in BC anyway, those are all dispensed from your agencies.
Okay,
generally.
which means they don't show up in this figure. They show up in the hospitals figures, okay? So, most patients leave a hospital and or go and see a physician in their office and maybe prescribe drugs, which they then go and purchase from a drugstore, a pharmacy, okay? That's what the 18% is, okay? And that number's been increasing, steadily increasing. Just came out this morning that the percentage increase of drugs last year was the lowest percentage in 10 years. In terms of percentage increase, it's only 5.2%. Most years it's 6 to 9% every year, drug costs going up. And physicians used to be the second most, greatest proportion. And about 5 years ago, 6 years ago, that changed and drugs became the second biggest. And that's continuing to grow. Drug costs is one of the issues facing the Canadian health system, is cost of drugs. Okay? So, this are all the drugs sold in retail pharmacies. Drugs in hospitals are inside this number. There's how the healthcare system is changing. Okay. In this particular analysis, in '76, 6% of the costs were hospitals and physicians. They didn't split out physicians in this particular analysis. By 2008, that had dropped to 41%. Yeah.
Does that percentage for drugs, does that include like pharmacist fees and dispensing fees and stuff?
Yes.
Like that?
Yeah.
It does, okay.
Yeah. All costs around drugs related to retail pharmacies. Okay. And you can see that long-term care has increased as well. So provincial variations, just quickly.
Dr. Protti,
Yep.
just on that last slide, in terms of the other professionals, does that include like nurses in hospital, or are they included in
No,
hospital?
they're included in hospital. Yeah, hospital nurses are inside the hospital. All the other kinds of professionals outside the hospitals that are in there. Okay. So actually, come to think of it, I'd have to double check where that drug costs are. Whether they're the fees for pharmacists, whether they're in the drugs or whether they're in the other professions.
Because like in
I'm not
Ontario, you can spend $15 on medication, but then spend $12 on dispensing fees.
Yeah, yeah.
So
I'd have to
it's
check.
sometimes a significant portion of what you're spending on
Oh, yeah.
to get the medication itself. And it's not
Yeah. Especially if you're on a lot of medications. These are where seniors are. Okay, just to show you the provincial variation, okay? It's not huge, but there is a noticeable as to how much each province spends per capita. Again, the percentage gives, okay, this reflects, you can see that the less well-off provinces, Nova Scotia, New Brunswick, Manitoba, are spending a higher proportion of their own